Prediabetes means you have a higher than normal blood sugar level. It's not high enough to be considered type 2 diabetes yet, but without lifestyle changes, adults and children with prediabetes are at high risk to develop type 2 diabetes. If you have prediabetes, the long-term damage of diabetes, especially to your heart, blood vessels, and kidneys, may already be starting. There's good news, however. Progression from prediabetes to type 2 diabetes isn't inevitable. Eating healthy foods, making physical activity part of your daily routine, and staying at a healthy weight can help bring your blood sugar level back to normal. The lifestyle changes that can help prevent type 2 diabetes in adults might also help get children's blood sugar levels back to normal. Welcome to this health channel. Watch the full video to learn more about what is prediabetes. What is prediabetes? Prediabetes is a serious health condition where blood sugar levels are higher than usual, but not high enough yet to be diagnosed as type 2 diabetes. Approximately 96 million American adults, more than 1 in 3, have prediabetes. Of those with prediabetes, more than 80% don't know they have it. Prediabetes puts you at increased risk of developing type 2 diabetes, heart disease, and stroke. The good news is that if you have prediabetes, the CDC-led National Diabetes Prevention Program can help you make lifestyle changes to prevent or delay type 2 diabetes and other serious health problems. What causes prediabetes? Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into cells for use as energy. If you have prediabetes, the cells in your body don't respond normally to insulin. Your pancreas makes more insulin to try to get cells to respond. Eventually, your pancreas can't keep up, and your blood sugar rises, setting the stage for prediabetes and type 2 diabetes down the road. Causes. The exact cause of prediabetes is unknown, but family history and genetics appear to play an important role. What is clear is that people with prediabetes don't process sugar properly anymore. Most of the glucose in your body comes from the food you eat. When food is digested, sugar enters your bloodstream. Insulin allows sugar to enter your cells and lowers the amount of sugar in your blood. Insulin is produced by a gland located behind the stomach called the pancreas. Your pancreas sends insulin to your blood when you eat. When your blood sugar level starts to drop, the pancreas slows down the secretion of insulin into the blood. When you have prediabetes, this process doesn't work as well. As a result, instead of fueling your cells, sugar builds up in your bloodstream. Signs and symptoms. You can have prediabetes for years but have no clear symptoms, so it often goes undetected until serious health problems such as type 2 diabetes show up. It's important to talk to your doctor about getting your blood sugar tested if you have any of the risk factors for prediabetes, which include 1. Being overweight, 2. Being 45 years or older, 3. Having a parent, brother, or sister with type 2 diabetes, 4. Being physically active less than 3 times a week, 5. Ever having gestational diabetes or giving birth to a baby who weighed more than 9 pounds. 6. Having polycystic ovary syndrome. Race and ethnicity are also a factor. African Americans, Hispanic, Latino Americans, American Indians, Pacific Islanders, and some Asian Americans are at higher risk. Preventing type 2 diabetes. If you have prediabetes, losing a small amount of weight if you're overweight and getting regular physical activity can lower your risk for developing type 2 diabetes. A small amount of weight loss means around 5% to 7% of your body weight, just 10 to 14 pounds for a 200-pound person. Regular physical activity means getting at least 150 minutes a week of brisk walking or similar activity. That's just 30 minutes a day, 5 days a week. A lifestyle change program offered through the CDC-led National Diabetes Prevention Program can help you make those changes and make them stick. Through the program, you can lower your risk of developing type 2 diabetes by as much as 58%. Highlights include 1. Working with a trained coach to make real, lasting lifestyle changes. 2. Discovering how to eat healthily and add more physical activity to your day. 3. Finding out how to manage stress, stay motivated, and solve problems that can slow your progress. 4. Getting support from people with similar goals and challenges. Metabolic syndrome. When certain conditions occur with obesity, they are associated with insulin resistance and can increase your risk for diabetes and heart disease and stroke. A combination of 3 or more of these conditions is often called metabolic syndrome. Risk factors. The same factors that increase the odds of getting type 2 diabetes also increase the risk of prediabetes. These factors include Weight. Being overweight is a primary risk factor for prediabetes. The more fatty tissue you have, especially inside and between the muscle and skin around your abdomen, the more resistant your cells become to insulin. Waist size. A large waist size can indicate insulin resistance. The risk of insulin resistance goes up for men with waists larger than 40 inches and for women with waists larger than 35 inches. Diet. Eating red meat and processed meat and drinking sugar-sweetened beverages are associated with a higher risk of prediabetes. Inactivity. The less active you are, the greater your risk of prediabetes. Age. Although diabetes can develop at any age, the risk of prediabetes increases after age 35. Family history. Your risk of prediabetes increases if you have a parent or sibling with type 2 diabetes. Race or ethnicity. Although it's unclear why, certain people, including Black, Hispanic, American Indian, and Asian American people, are more likely to develop prediabetes. Gestational diabetes. If you had diabetes while pregnant, you and your child are at higher risk of developing prediabetes. Polycystic ovary syndrome. Women with this common condition, characterized by irregular menstrual periods, excess hair growth, and obesity, have a higher risk of prediabetes. Sleep. People with obstructive sleep apnea, a condition that disrupts sleep repeatedly, have an increased risk of insulin resistance. People who are overweight or obese have a higher risk of developing obstructive sleep apnea. Tobacco smoke. Smoking may increase insulin resistance and can increase the risk of type 2 diabetes in people with prediabetes. Smoking also increases your risk of complications from diabetes. Subscribe to our channel to keep up with new content. Your support and feedback are much appreciated.